Okay. So welcome everybody, and thank you for joining us again today. My name is Hilaria Asumu, and I am the chair um, of the WSH BME Kidney Network. So we are organized. This is another of our event series. Look Who's Speaking. We organize this series of talks on different issues once a month to provide clarity on different issues on kidney disease, organ donation, and other topics. I am the chair, as I said earlier on, of WSH BME Kidney Network. I will moderate this session today. Our charity is based in Manchester, and we provide advice, support, advocacy, and education to kidney disease and transplant patients and their families who find it difficult navigating government systems and institutions. We also campaign and raise awareness about organ and blood donation. So today we'd like to welcome to our platform Pauline Barnett. She is a fertility and reproductive health advocate working in the Black community with families with fertility challenges. Pauline will talk about fertility and reproductive health in the Black community. This is a follow-on from last month's topic, pregnancy, childbearing, and renal transplantation. If you missed that session, you can watch a replay on all our social media platforms. I hope that by the end of this session, you should have enough information about this topic to help you make that decision about donating to improve other people's lives. Before I hand over to Pauline, I would like to go over the housekeeping for this event. The session will run for approximately 1 hour. Pauline will speak for 30 minutes, then a question and answer session for 15 minutes. If you have questions, put them in the chat and we'll answer them at the end. I will hand over to Pauline and welcome Pauline to WSH BME Kidney Network platform. Thank you for giving us your time. So just to start off, this topic you're going to be talking about today, what is it about? Can you, enlighten us and, help us understand, how we can help other people in our community?
Hi, sorry, I've had a little bit of a tricky throat over the last couple of weeks, so hopefully everybody can hear me. Thank you very much for inviting me to speak at this session. And as I say, fertility is a passion of mine. I've been involved in fertility and reproductive medicine for an extensive number of years, probably about 32 now. And this is a platform that is giving me the opportunity to help my clients, my patients, meet their desire to become pregnant. So, Hilary, your opening statement was an ideal one for me to jump on board. Donating, and I know particularly you were talking about organ donation for your network and your help and services that you provide for the community who have undergone kidney failure, kidney transplants. But I think your definition there was perfect. Donating is to improve other people's lives. Now, what I want to talk to you about today is the specific areas of donating eggs. That I will touch on a little bit about donating sperm and embryos, but a little bit more about my background. I do work in reproductive health, and it's inclusive of the Afro-Caribbean Black minority community, but also for all patients, all clients struggling to conceive, whether they're at the stage of inquiring about their fertility, looking at ovarian preservation, or if they're actually embarking on investigations and treatments. I care for patients of all aspects of the journey and all aspects of fertility issues as well, from unassisted reproductive or unassisted conception, that's where they're just trying to conceive at home, all the way through to undergoing IVF treatment, couples who are using gametes, donor sperm, donor eggs, couple where they have infertility related to male factor, couples who are embarking on the strongest kind of fertility journey as possible, which is surrogacy, the need to involve another person to help them achieve their pregnancy by carrying their precious embryos for them. So all aspects of fertility, my role involves from the physical side, the intervention side, the emotional aspects of fertility. But as I say, today I will be focusing on gamete donation, and particularly where it talks about egg donation. I'm going to try and share my slides with you now, if that's okay. Now, hopefully this will work. So, gamete donation. Now, what is a gamete? A gamete is a single cell. It's a sex cell, and it either comes from the egg of a female or the sperm of a male. There are also zygote or embryo donation protocols and packages of care that we deliver. Today we will be focusing on gamete donation. Now, donation is, again, something that's going to improve somebody else's life. It is a gift of life. There are forms of donation which you're all familiar with, monetary donation, but of course we're looking at gamete donation in this aspects, and it's a donation to benefit someone's personal life to attain what their desire is. What you may well ask is, why would a woman or individual couple want to receive an egg from? Now, this affects women, or is pertinent to women who cannot produce their own eggs for one reason or another. They may not be producing eggs because their ovarian function has failed, or they have a low ovarian reserve. The eggs that they produce may be of poor quality, and a poor quality egg yields to a poor developing embryo. An embryo that may have anomalies and doesn't implant successfully within the womb, the endometrium, or as we know it, the uterus lining. These poor quality eggs yielding poor quality embryos often relate to an outcome of recurrent miscarriages. Miscarriages is very common in the general population, but we do see it more pertinently when we are dealing with fertility patients. The other reason why we may need to consider receiving or looking into egg donation as a pathway to a successful outcome is if women have experienced the menopause, particularly the menopause at an early stage. This is termed as perimenopausal conditions. And it's unfortunately, if it does affect somebody who is under the menopausal age, as we tend to find that menopause comes into effect when women reach 45, 55, 60. But it can actually have an effect on women who are younger. They find that their periods have stopped, their cycles are becoming very irregular, or the periods are light and scanty. These are the situations where it's very important to seek some medical advice if you do experience these conditions, these symptoms, and you are still of the reproductive age or believed to be of the reproductive age. So perimenopausal conditions can affect women in their 20s, in their 30s, and in their 40s. With these situations, they do seek to achieve a pregnancy through donation from a woman who has got younger, healthier eggs. The other situation where you may find that egg donation is required is if there are any genetic issues or inherited diseases. If there is an inherited disease in the chromosomal makeup of a female or a male if it's male factor and needing sperm donation, the risk is increased in a pregnancy of passing on this inherited disease or disorder to any child or children conceived. So to eliminate the risk, reduce the risk, then egg donation is recommended. The final condition, which I've put on here, is a genetic disorder of the female. And the particular one I'm thinking of is a term or a condition called Turner's syndrome. Turner's syndrome is where a female is born without the ovaries or underdeveloped ovaries, again limiting their chance of conceiving naturally with their own gametes. Now, this audience, and again I thank you for inviting me, has allowed me to examine why there is possibly a lack of donors in general, but I will concentrate on the diverse community which we are all from. There was a new change in the law in 2005 where previous to this time period, egg donors and sperm donors and embryo donors would come forward and generously donate their gametes to an anonymous recipient and basically walk away. When the change of the law came in, it removed the anonymity from these individuals. With saying that, that meant there was uncertainty as to what would happen if these individuals, male or females or couples, donated their gametes. What would happen to their rights? What would happen to if a donor-conceived individual approached them later on? What would their rights and responsibilities be at that stage? With this uncertainty, there was an extensive drop of donors coming through the door. And for the last 15 years, there have been very few donors coming forward to help couples who require their gametes through a donation program. They are steadily starting to come through now because of I think that's due to the realization of the laws and the regulatory conditions of their donation, which I will explain later on in the next slide. Now, the major factor that I find, as I say, I've been working in reproductive medicine for a long time, is there's always been a lack of donors, egg donors in particular, coming from the ethnic minority communities. We've explored the reasons why this could be, and I believe it's down to lack of awareness that you can come forward and help somebody else by donating your eggs, by donating your embryos. The understanding of what that involves has been a kind of a stigma behind it. What I want to do today is address all aspects of this, and I hope that this talk does generate the questions that are lingering in the mind of many, many people. There is so many opportunities for women, young men to come forward and help people within their community. If there is awareness and knowledge comes with this, then hopefully this will raise the interest to help. Couples outside of the diverse community of the ethnicity which I'm relating to, which is African, West Indian, Chinese, Japanese, couples struggle to achieve a pregnancy because of the lack of donors coming forward to help them achieve their desire to become parents. Once there is an opening and it's obvious by diagnosis, investigations and findings that egg donation is required to achieve a pregnancy, a lot of our couples within the reproductive field are opting to accept donors, egg donors, sperm donors outside of their ethnicity. This has a devastating effect and could have a devastating effect on the children born through donation. The acceptance for the parents who have these children who are obviously not of their ethnicity. For example, we have some Asian couples desperate to have children will accept an egg donor who is for the Caucasian race. We try and match as best as possible with regards to eye colour, hair colour and skin tone, but there is still the acceptance of the non-ethnicity match to achieve their desire to have a child. I think in long term, it can have an effect. And on this slide, I've got the initials here, WOC, which really concentrates on the welfare of the child or children born from donation to couples who accept donors outside of their ethnicity. But the desire, again, I talk strongly about the desire to achieve a pregnancy, to have a child, to have a family, to be part of society's acceptance, overcomes that desire to wait for a donor from their ethnicity. Couples do, unfortunately, end up being childless because of their wish to continue a family from donors, from the help of a donor who is from their background, ethnic background. The donors are very rare that come through, and it is unfortunate that many of our couples do come to the end of their fertility journey being childless. Now, the next slide will talk you through what is required to become an egg donor. Egg donors have to be vigorously screened. Absolutely so. Not everybody is suitable to be an egg donor. We do understand that. And I will take you through each stage as clearly and transparently as I can. And as I say, if there are any questions, please let me know. I'll be happy to address them. So the first requirement for the suitability of an egg donor is the age. Now, in the first slide, I talked about the quality of an egg and leading to the quality of an embryo. So egg donors have to be within the age range of 18 to 35. We know that by the age of 35, fertility plummets. The age-related quality of eggs and embryos drops when a woman reaches 35 and over. The aged egg yields a higher risk of anomalies present and the failure for these embryos to implant successfully and to attain an ongoing pregnancy. However, through my personal experience, I have seen that fertility drops a lot sooner. Now, at the end, I will talk about fertility preservation and to give you an insight of what couples or individuals need to consider now for their fertility. So age is a very important factor. Being of a younger age group, you have a better quality egg and a better and stronger, more last-lasting ovarian reserve. All donors undergo a full medical history. This includes a medical background for their parents, for their grandparents' history, as far back as they can go. And we ask the questions relating to their health, their lifestyle. They are recommended and ideally do not smoke, do not drink excessively of alcohol, have a good BMI, which is under 30, and shows a healthy lifestyle, a good diet, have no inherited disorders and diseases, and have no conditions that would eliminate them from possibly donating. We do have, within the reproductive community, have a right to contact their GPs if there is any missing gaps in the potential egg donor, embryo or sperm donor's history. It's important to point out at this stage that a possible egg donor, an intended egg donor who has been adopted, cannot donate. And that's purely because we cannot obtain the medical history that's required for the assessment process. The next stage of acceptance or consideration for accepting for an egg donor is a full examination. And that involves attendance to our clinical environment to undergo a ultrasound examination, pelvic ultrasound examination, and this is done transvaginally. An internal probe is placed through the vagina to have a look at the pelvic regions. The organs that we're concentrating on in this aspect are the ovaries, obviously in particular, the womb, to ensure that there are no complex structures which will prevent them from safely being stimulated. While we assess the ovarian appearance, the ovarian position, we're also looking at the ovarian activity. And by this, I mean that we count the antral follicles present within the ovaries at that time. Now, an antral follicle is a potential follicle which will grow at a particular time of the menstrual cycle. This then ovulates, releases the egg, and if there is sperm present, fertilized by the sperm, and hopefully pregnancy is achieved. So when an egg donor presents for a possibility of being selected to donate, we examine the ovaries to see their antral follicle count. Ideally, a good healthy ovary will have about 20 to 30 antral follicles, and they're just waiting to be stimulated each month and attain a pregnancy. Not all follicles released each month will be viable to become a good egg, and we lose these in our natural menstrual cycle at the end of each month. So examination through ultrasound via a vaginal probe examines the appearance of the ovary, the position of the ovary, and I'll explain that a little bit later, and the actual ovarian reserve, and that's the antral follicle count. If an antral follicle count presents less than 20 in number, they are not likely to be accepted to become an egg donor, and we may well advise them and guide them to consider looking at their fertility life at that present time. The next stage of assessment relates to the psychological and counseling aspects. Why are you considering to be an egg donor? What spurred you on to approach a clinic to decide on donating? They may well have come through because they have some background history about fertility struggles, maybe from a friend, an associate, and they want to know more about what they could possibly do to help. Some women come through requesting or expressing an interest to be an egg donor because they want to donate specifically to one person, and that's called known donation. And that's where they donate all their eggs to one known recipient, and there are implications associated with that, which I'll talk about again shortly. So once they come through and we ascertain that there are genuine reasons for them to wish to be considered to be an egg donor, the implications surrounding their intention to donate are explored in greater length. Now, the implications of becoming an egg donor are at the moment, again, quite new, because if you recall, I talked about the change in the law in 2005. They changed the anonymity process, which means that a donor-conceived child or adult at the age of 18 can find out a little bit more about their genetic origin. Now, if a donor at this stage comes forward, we have to ensure that they fully understand that there is a possibility in the future that the donor-conceived child who was born from their donation may come in contact with them at some point. And when I say come in contact with them, it's not a direct contact. It's an inquiry, and an inquiry about their the reasons why they donated, if there was a message left to them, and I'll make that a little bit clearer down the line when we talk about donation completion. So the implications are discussed and explored very carefully. And we do have independent counsellors, aside from the medical team, who will deliver these implications. The other implications that we discuss with them is that we emphasise that they have no rights or responsibilities over any child or children conceived from their donation. And that alleviates the worry or concerns that a potential donor may have. We also give them an opportunity to consider the implications. Donors are never forced or strongly encouraged to come forward. It's totally by will and by gift that they make the contact to us. On completion of their implications counselling, and they still have a desire to help, then we bring them into the programme, and following full consultation, which involves a full outline of their fertility donation journey, they still have an opportunity at that point to withdraw their consent or their intention to donate. At any point, donors can withdraw their consent or intention to donate up until the day the donation takes place. And I will tell you all about that journey as well. Now, the treatment program takes a short period of time, but the preparation takes the longest. The inquiry, the obtaining the medical history, the examination, and the psychological implications counselling. Sorry, I forgot to admit that during the medical history, there is a vigorous screening test carried out. And these involve assessments via blood test and via urine. So we do a full examination, serum and urine examination, to eliminate any risk factors of the potential donor carrying infectious diseases, such as HIV, hepatitis B and C, a virus called cytomegalovirus, and your extensive investigations such as HTLV, which some women or men in egg and sperm donors carry if they come from a country that is pertinent with these disorders. We also screen for their chromosome makeup. So we do a full DNA profile and look at the culture of the DNA sex cells assessment. We also screen them for cystic fibrosis to ascertain whether they are carriers of this disorder. We do a full ethnic screen, which involves carrying of T cells, and that's common in the Jewish population. We examine for sickle cell, which is pertinent in the Afro-Caribbean community, and we look at other disorders that could be ascertained from the Mediterranean communities. So they have a full blood test and urine test. The urine test examines syphilis, gonorrhea, and chlamydia. So all our donors are vigorously screened. Psychologically, they have the opportunity to discuss the implications. They have a full examination, and based on the outcomes and results from this, then go on to the consultations, which briefs them carefully about what the next process will involve. Now, the treatment program involves stimulating the ovaries to encourage the ovaries to grow. If you recall, I said at the beginning, each month a woman develops a dominant follicle which has a growing egg inside. This reaches the mid-cycle, which then encourages ovulation of this dominant follicle. The ovulation bursts the follicle, an egg pops out and seeks the presence of sperm. If sperm is present, then fertilization takes place, and hopefully then implantation takes place. So in a treatment cycle, for women who are having fertility treatment themselves, the egg donor goes through the same process. They have injectable hormones, which encourage the stimulation of these follicles that they have present in their ovaries. and encourages all the follicles present to grow and be responsive to the medication. They are then invited into the clinics to have their stimulation monitored. We count the follicles that are present, we measure the follicles, and we repeat these monitoring sessions, maybe 2 or 3 throughout the whole treatment program, until they are ready to be taken to the operating theatre for a minor operation which extracts the fluid from the follicles, which are the egg sacs. You cannot see the eggs on ultrasound imaging. You can only see the eggs once you've retrieved the follicles, emptied the fluid, and see the egg under the microscope. Now, the day of the egg collection, the egg extraction, that is the day that the donation is complete. That is the day that up to that point the donor can withdraw her consent, but on the day of the egg collection and the completion of the surgical retrieval, they cannot no longer change their mind to donate. They are counselled and supported all the way through, and if there's any point where even we feel as practitioners they are struggling with their intention, we advise them to withdraw. Because at the end of the day, once you have completed your operation, the egg retrieval process, your donation is complete. You are supported, the donors are supported all the way through, as I say, and have opportunity to speak to our team or the teams that they are attending in a specific clinic, and any concerns are raised are addressed straight away. Everything that they undergo is private and confidential to them and their medical teams that are looking after them. We can obtain information, as I said at the beginning, from their general practitioners with regards to seeking more information about their medical history. However, we do not disclose their intention to donate or the fact that they have been an egg donor to anyone outside of the reproductive regulatory bodies, which I'm not sure if anybody's aware of, which is the HFEA, the Human Fertilization and Embryology Authority. This organization governs all fertility license treatments, and they also keep a record of donors going through the process. Now, an egg donor, a sperm donor, or an embryo donor can achieve up to 10 families, can create up to 10 families, which means that they can successfully donate 10 times or more. But a family is an outcome, a successful outcome, a live birth. So if you can imagine an egg donor going through this process 10 times, I don't think I've come across anyone who's had that many donations, but they can, and the family limit is 10. And that's an important thing to point out. It's the same process for a sperm donor. The family limit is 10. And anyone who intends to donate their embryos, family limit is also 10. Now, as I said before, that every donor that comes through a fertility clinic is recorded by, and the data is held by the HFEA. So this regulates how many times they can donate in the UK. This law does not apply to outside of the UK. This is a UK regulatory law. As also to bear in mind, it is private and confidential. When I say that, that means a donor comes through, her information will never be disclosed to the recipient couple, the ones receiving their eggs, and the same applies vice versa. Recipient couple will never, the information will never be disclosed to the potential egg donor. Unless, as I've said before, a donor comes through as a known donor and they will specifically donate to somebody who is directly related or known to them. Now, once the donation is complete, and that's on the day of the egg collection, the eggs are retrieved via surgical aspiration, and this is done under sedation, so the donor is made very comfortable through the process. They have sedation they can sleep through the process. It's conscious sedation. And then they're looked after in the recovery area. Again, private and confidential. No information is disclosed during that process. And their donation is completed on that day. They are made aware of the numbers of eggs they've successfully developed and how many are suitable to be donated. They will have that information and can take that information away. They can find out at the end of their donation, a couple of weeks later, if their donation has been successful. They can find out if their eggs were used by a couple or individual, because we have some women who are coming through as lone parents. So they can find out if their donation has been if their eggs have been used and if their donation has been successful. And if their donation has been successful, for example, if a pregnancy has been attained, they can find out 9-10 months later if a child has been born from their donation. Now, I say they can find this out. This is not information that will be given freely to them if they do not wish to know. And it might sound strange to hear that, but a lot of donors come through with the intention just to help somebody, to give them the gift of life. And they do not always want to know what the outcome is. Now, the reason for this may be that they're happy to help, but don't want to worry about the outcome. They're happy to help, but don't want to feel that if it hasn't been successful, they've let them down. Because in reality, just coming forward with an inquiry to be an intended egg donor is a massive, massive benefit to couples who will receive. And it's a vast appreciation for their thoughts process of coming forward. And so to have the opportunity to have a chance to become pregnant is overwhelming to our recipient couples. And I get many couples saying how grateful they are. And it's unfortunate they cannot actually give them a gift themselves directly because of the risk of exposure to their identity. Now, the last thing on my slide here is there is a compensation award. Now, this compensation award has been reviewed over the last 15 years, and I'm pleased that the Health of the Authority, the licensing authority, the Human Fertilization and Embryology Authority, have reviewed this award. Now, it is classed as a compensation rather than a payment for donors. And I'm happy to disclose the information about the compensation amounts if anybody is interested in that. This is to say that we appreciate women or men coming forward and giving up their time, exposing themselves to the various aspects of investigations, the monitoring, it can be classed as a little bit of invasive, the internal examinations, the time off that they have to spend attending for appointments and undergoing a small operation as well. But it's pleasing to know that we do recognise this and offer a compensation for your time and your consideration to donate, and awarding you back for giving other couples a gift of life is something that it just goes beyond words. Now, maybe there is some questions at the end, but I'll carry on with a little bit more about the injections. The injections that the women who are accepted to be an egg donor are fertility injectable hormones, which are commonplace throughout the UK. These medications won't lead to any adverse side effects. We do train you how to do your injections at home, so it reduces the amount of time that you have to attend for these daily injections to be carried out within a clinical environment. They're easy to use. They're very much like the diabetic insulin pens. Injectable hormones come in almost what we call a pen format. So inject the pen and dispose of your equipment in the disposal units that we provide for you. The operation itself it will take about 20 minutes to extract your eggs from your ovaries. And again, there are implications with any kind of surgical procedure, as if you were going to have your tooth out, there are implications with that, same as any kind of invasive procedures like IVF egg collection procedure. But you'll be guided and advised about this all the way through. And I reiterate again, you can withdraw your consent to donate at any point up until the day of the egg collection procedure. You will never come into contact with any your potential recipient. And if it was to be that 2 appointments were made on the same day, you will be always at different times of the day. For instance, the egg donor could be seen in the morning and the recipient may be seen in the afternoon. So there's no risk or chance of you possibly meeting in the same waiting room. It's a very short term when it comes to the actual procedure, but the investigation side of it is the lengthier side. Your characteristics will be taken and matched with the appropriate recipient, and again, everything will be kept confidential, and no information will be given to any other party involved. Now, when it comes to recording your details as a donor through your donation program, we take your history, as we said, your physical characteristics, and they are recorded and kept confidential. There are 3 aspects on a written information form that you can disclose to the potential child or children born from your donation, which is termed as your pen portrait. So as an egg donor, you can give a little bit of information, a background about yourself, which could be accessed by the donor-conceived child when they reach 18 or above and want to know a little bit more about you. Obviously, this information must not disclose anything specific, like where you live and what school you went to, but more or less a little bit about yourself growing up, what you liked, what you disliked, and what your favorite hobbies were, what your interests were at the time. And this information, as I say, can be transcribed to any child or donor conceived adult if they wish to find out a little bit more about yourself. That actually comes to the end of the slide and presentation. And if there are any questions, I'll be happy to answer them for you. Thank you very much for listening.
Okay, thank you very much. Thank you very much, Pauline. And we've had quite a few questions coming, quite a lot of them actually. So I think we'll just go with this first one. Why do embryos have anomalies and what causes them? Are they not accessed like organs or tissue for organ or tissue donation?
Yeah, it's a good question. Sometimes I think I often wonder how we got here as we are, because the biology and makeup of embryo development is massive. And to discover the reality of what goes into it is so extent. Well, an egg is an egg. It is a single cell gamete, but within that egg, it carries so many chromosomes. These chromosomes are often normal. We are created from normal chromosomes within the embryos. Now, the egg has a certain number of markers, 23 chromosomes. The sperm has 23. Now, when they join, you make one whole embryo when it's fertilized. Yeah. However, when there is an anomaly, there may be one of the chromosomes that's either dislodged its arm or the leg of the chromosome, and it gives you an abnormality. The most common ones that we know of are the trichromosomes, which lead to Down syndrome. You will see that there is an anomaly of, I think it's the 21 chromosomal arm is missing. This will lead to an abnormality in that aspect. There are so many genetic disorders, and if I had the time, I would love to go through the genetic of it or not.
Yeah.
However, it doesn't have to be even a chromosomal marker that makes it abnormal. Once you've got your egg and your sperm and they fertilize, you then assess the embryo development. Now, over a number of hours, you will, and these are where the scientists play their best part. They can assess the embryo development, cell structure, cell appearance, and they look for anomalies. Now, over a number of hours, your two cells, which is your egg and your sperm nuclei, form. Then they start to split. They become a 4-cell embryo. And over the next 12 hours, they become an 8-cell embryo, and such until they get to maybe 5 days old. Then they become a blastocyst. Now, by that stage, or during the process, if you see a cell and it's a 3-cell, for instance, and it's beyond the time limit that it should be, that's a normal cell. That's an abnormal embryo. So assessments will be made by the scientific team to look at anomalies in the growth, in the cell division, in the cell appearance. What makes it abnormal? It could be the quality of the egg. It could be the quality of the sperm. The sperm is made up of a head and a tail, and on the head you have the acrosome section, which carries the chromosomes. Now, if during the fertilization stage, where the sperm penetrates the egg, it may knock off one of those chromosomes and still fertilizes, but it's abnormal because it's missing some of its links. So what makes it abnormal is very, very difficult to explain. We have done studies, many studies, throughout reproductive field. Now, a couple can produce 8 embryos, and in those 8 embryos, 4 of them will be abnormal. The appearance is similar, but 4 of those will be abnormal. And that's the outcome.
So what's in terms of, because recently there was something in the news about a lady from, I can't remember if it's Iran or so, or somewhere in the Arabian countries, and she had 9 children. How did that happen? Because I was a bit amazed, and they're all very healthy. How did that happen? How can one person carry 9 embryos?
Octopus, yeah. Oh, yes. It's very unusual, but we don't always know whether this woman had a natural multiple pregnancy, or she underwent some form of fertility treatment. That's the first question, okay? And in nature, as I said before, we have one developing follicle. This follicle grows, finds sperm, ovulates. There are some situations in nature where 2 eggs are released at the same time at ovulation, and both of these are fertilized by the sperm. Now, in ejaculate process, you may have like 300 million sperm released at one time during intercourse. So some of those are going to get through the mucus and straight to the ovary. Now, if there are 1 or 2 eggs waiting, they will fertilize them. So in natural conception, if there is 2 eggs ovulating at the same time, we get your twins. If there's 3, you get your triplets, and so on and so on. So this situation that you've just referred to often relates to some sort of fertility treatments.
I see. Okay, because I was a bit surprised by that. Yes.
Or she's very highly fertile, which again is against nature.
9 children.
Yes, and well, 9 eggs were released at one time, basically. That's what it was. And 9 eggs got fertilized following intercourse. So it's very rare that this will happen. There are situations in natural conception where 3 eggs have been released, mature eggs have all been fertilized. You get your natural triplets, but that's also very rare.
Okay.
We do know about twins in nature, but very rare. Without assistance, will you get a multiple pregnancy like that?
Yeah. Okay. Thank you very much. There are some questions that have come up from outside of the platform. Okay, Sri has put that up. Would continuous egg donation without a rest period in between affect future pregnancies?
Yes, I assume they mean their future fertility.
Yes, future fertility, I would think.
Yes, without rest, I mean, we do advise couples to have a break when they have a fertility treatment, and this is continuous for them to conceive.
So
Now,
how long would that be for? How long would that rest period be?
at least two natural periods.
Oh, okay. So that's 2 months.
2 months.
Okay.
2 months of natural periods.
Okay.
Now, once you've been exposed to fertility treatment, injectable hormones, your cycles may be slightly altered. So it may be 3 months that you're waiting, but at least 2 natural bleeds before you embark on another stimulated cycle.
Okay.
Now, for an egg donor, continuous donation, we would strongly advise them to have a break in between. Now, because they're not trying to conceive themselves, there is no rush for them to have these back-to-back cycles to reduce their failing fertility or ovarian reserve. I would definitely say consider a break in between.
Okay.
And again, it depends on how old they are when they approach us. And again, this is based on the UK regulations. So if they're approaching 34, 35 and they want to get 2 or 3 cycles in, However, we'll probably find some interesting factors when they do donate. One, their ovaries may be going on the lower side for production anyway, so they may need to think about their own fertility. Now, I didn't mention this during the talk, but why do donors come forward? One, they've already attained their family, so they don't intend to become pregnant in the future. 2, they don't want to consider becoming a mother right now, but wish to donate and help. And the third ones are the ones who just have no intention of being a parent at all, but feel they're happy to donate because the term that they've used is they don't want to waste their eggs and want to give to somebody else.
So can somebody donate eggs if they have no children?
Yes.
That is if they haven't had children at all or can't have children.
Absolutely. You do not have to have proven fertility to become a donor, but you do have to have evidence of good ovarian function, good ovarian reserve to be suitable to donate. Yes.
Okay. And can cancer survivors donate eggs as well?
Survivors?
Yes, cancer survivors, can they donate eggs?
No, because there is a drastic effect on ovarian quality for women and men who have undergone cancer treatment. They may have, it's the toxic chemotherapy that they've had diminishes the quality of eggs. Now that's another aspect of talk, and this is covered in fertility preservation.
Yes.
You do need to be very firm and proactive if you have a diagnosis or a suspicion of cancer to seek assistance to preserve your fertility at the earliest opportunity.
Okay.
For women who are potentially suffering from a cancer diagnosis.
Okay. Sorry, can you put that question up again? I didn't want to. Yes. Okay. So if I have frozen eggs and have now completed my family, can the eggs be donated?
Yes, they can, as long as they have undergone the screening in preparation to donate. Now, I talked about the screening before. So we can't we can't screen eggs later. We screen them before, or we screen the health of the woman before. So if there is, they've had the chance to have the full investigative screening process carried out, then they can donate. Now, that's an interesting question. If they have frozen eggs, they would have frozen their eggs for their fertility preservation for future pregnancies. So if I would like to go back to that person who posed the question and to find out, have they completed their family now and have surplus eggs which they wouldn't wish to donate? Are they under 35? And how many eggs do they have spare? Ideally, for couples receiving donated gametes, eggs, we do aim to offer them 6 eggs as a minimum, giving them a chance to attain at least 2 or 3 good embryos for their future treatments.
Okay. So what if somebody had done a treatment before, or that is somebody that's been donated to a family, and they've had a child, and then at that point they didn't think they wanted to freeze their eggs. So what happens when they come back, and they don't have any eggs? And there are no, some people want people come from their own ethnic background. What happens then? Can they bring somebody from their family, a friend, or as a donor? What is the process for them to do that?
Okay, so just to make sure I understand the question, Hooray. So are you asking if somebody finds out that they possibly are infertile?
Yes, after having a baby.
Yes, so they want to have a baby, and they want to use a family member or a friend.
Yes.
Yeah, they can bring them forward as a known donor. Okay, so they become their known donor. They know who the eggs are from. The donor knows who the eggs are going to. However, they must still follow the screening, the matching process, age-related, to be able to accept. There is a situation here where, because there is lack of donors coming forward, and there are similar situations where I've had women who will only receive from their sister, their sibling. Their siblings are outside of the matching process, the age and such like. Even the ovarian reserve, then we can make application to say, because of this situation, they're happy to accept that there may be fewer eggs, no eggs, and wish to only go ahead with this known donor, and we could put a case forward. And absolutely correct, because it's still giving them a chance. They are aware of the risk, the limitations, and the possible poorer outcome if, say, for instance, their sister is 40, have a lower ovarian reserve, but if she's got 2 or 3 follicles, she's happy to take that chance.
Okay.
It goes with strong counselling and lots of support.
Okay. Yeah. Surya, can we have the next question? I think there's one about that. So that's another question. I was told there's a payment for donating eggs. Is this legal, as there's no payment for organ, tissue, or blood donation?
It is. It is. And as I said in my presentation, I'm very pleased that the licensing authority have reviewed the payments. They don't call it a payment for donating, but they call it a compensation reward.
Yeah.
Now, there is a compensation of £750 for each donation.
Okay.
And this is payable at completion.
Okay.
All right. Okay. So if you can imagine, there's a process first, the investigations, screening, the matching process, and you get a call from me. Everything's fine. Let's talk about the protocol a little bit more. And when they actually embark on the donation program, that will take about just over 2 weeks.
Okay.
The most.
Okay.
The day of the egg collection, we see them again, make sure they're happy. We obviously do follow-up calls later and see how they're recovering. But that's that day of the donation when we can make the payment into their bank accounts.
Okay. So can people who are transplant patients, can they actually put themselves forward to donate eggs?
Transplant patients I'm not familiar with. So I'm going to learn a lot from you. Now, again, it goes back to ovarian reserve.
Yeah.
It depends on their situation. Again, age, what's their age group is the first thing.
Okay.
And then we start the screening process.
Yeah.
So if they have got good ovarian reserve, and their health will not be put at risk by undergoing a sedation process or a stimulation process, and these are using normal female hormones that have been converted.
Yeah.
And so if there is no risk to that person and they would like to be considered, then they will be seen and assessed by either myself or one of my colleagues for suitability. Okay. But I don't think there's anything that should rule them out other than good ovarian reserve.
Yeah. Okay, it would be because transplant patients are on suppressants.
Yeah.
So would that affect the eggs? Because currently we're not allowed to donate blood. So obviously, I would think that the eggs would be tissue, not organs.
You're correct. Well, it's a cell. It's a cell. Now,
Exactly. Yeah.
it's a cell. Now, can I ask you a question?
Yeah.
Do,
Go ahead.
do many of your kidney transplant patients go on to conceive?
Yes, they do. Yes, under careful monitoring by the renal physician and obstetrician as well. And that was one of the sessions we had last week to speak about that, because that is an issue in the renal community, especially amongst patients with transplant, because the kidney is just below the stomach. So carrying a pregnancy is a problem. So I think this just follows naturally from there for those people who will find it difficult to get pregnant, and also for those who will be thinking, I want to donate to a sister who is childless and doesn't have a child, or a brother whose wife can't get pregnant. So it's just wondering if the medication would affect the eggs that they're going to be donating, because currently we can't donate blood because of the medication we're on. So that's why I'm, asking that question.
Yeah, that's something that I would need to look into without knowing what the medications, but the immune suppressants, it doesn't really rule out the fact that it can donate or the quality, because as you said, they can successfully achieve a pregnancy and there's no anomalies with their children or babies born. So there should be no effect on that, but it's exposure to the stimulating hormones that might put them at risk or affect their recovery status, I suppose.
Okay.
But that's something that I could definitely look into. If anybody was interested, they can contact me, and then I can give them some more information about that. But it's again learning what medications they are on.
Yeah, we're all on different. We're all on
Absolutely.
different medications,
Yeah.
so it might not be the same. It would be doing the same work, but we have variations in terms of the medication that we're on.
Yeah.
Some people might be double transplants, so kidney and pancreas or something else. So usually be different medications. So it's just taking that into consideration when we're undergoing any treatment in any other area of medicine. So that's one of the reasons I'm asking, because I know that a lot of people watching the replay might want to know that and have questions as well. Sriya, can we have the next question, please? Okay, so some people have complained about the pain during the process. Do the hormonal injections cause pain? This is the same question we get about organ donation, because as Black people, Black community, we don't like pain. No. So what is your advice on this?
Oh, it's the medications have changed so much over the years now, and they're becoming much easier to use. Now, as I said before, I used to say 99% of our patients self-inject. 100% of our patients self-inject.
Yeah.
All our patients self-inject. And even the women who have got communication barriers, language barriers, they still know. We have a visual aid that you watch and follow. We have written instructions, and we have verbal information that we transfer during our consultation sessions. Do they hurt? Well, if I prick myself with a needle now, that's the amount of pain you're going to get.
Obviously.
Absolutely. They don't have long-lasting effects pain-wise. The side effects are also minimal. Now, again, I'm going back to sort of like 20, 25 years ago. Women who have different protocols, basically. We call this down regulation, when there are some centers that switch off your hormones completely and then pump you with drugs and say, grow your follicles.
Yeah.
In the clinic that I work, in the organization I work for, our ethos is the health of the mother and the health of the baby. So we minimize our stimulation regime and get the same outcome. And there are many clinics now, many centers who are duplicating our kind of care delivery. Okay. So we don't shut down your system. That medication gave drastic side effects. It put them in a menopausal state because we're saying to the ovaries, switch off and stop working for 3 weeks. Those side effects there were memory loss, headaches, feeling lethargic, feeling bloated as well because of the length of time they're on medications. However, more and more clinics now are reducing their exposure to injectable hormones, which is limiting the amount of side effects. Some women have different things for different reasons. If they need to suppress their endometriosis effects, that will take one of those medications, and it's just so specific for that care and delivery. However, fertility treatment now, it's almost like a pen. You dial the dose, inject yourself. As simple as that. It is daily, but it lasts about 8 to 9 days.
I see.
And different forms of injections come into play at different stages of your monitoring of your follicular development. All play a part in the effectiveness of good eggs at the end and hopefully good quality embryos. So very, very much reduced with the pain. The efficacy of the medication is absolutely brilliant now, and the compliance is very much accepted for all aspects. So they'll almost enjoy their treatment.
That's good. Can overseas patients donate if they don't have a medical history? Can they come in to donate to family?
Well, that's an interesting one. Yes, obviously they have to be in the UK for the length of the time of the donation.
Obviously.
We don't assess their status. They are recorded, as in they should have an NHS number at least, because that will be entered into the database for our authority body, which is HFEA. So if they come over to the UK, the best thing is to attain an NHS number. Here is very important because if there are any side effects or adverse outcomes, they will need to be treated. And it's very rare that will happen. But not just to come over and donate and go back, but at least to have the safety of having a NHS number.
So there is a question in the chat. It says, are there any reasons? This is something that I'm passionate about. In the Black community, are there any reasons why there is hesitancy in the Black community to donating eggs? So
good question. I really just think it is lack of awareness, and it's the unknown territory. And not only the fact of donating, I see this as the fact of accepting or applying for treatment. There are fewer people from the Black community who will go to the GP and say, I'm struggling to conceive. We've been trying for a few years. They're very silent with their medical intervention. And I've seen this over the years. And people who I've known who are my age group 20 years ago would come to me and say, well, I didn't know you did this. I could have asked for help then, but now they're too old to conceive, which is a shame because they've now been childless through not wanting to go and ask the GP for help. And why do we do this to ourselves? That is a big question.
And because we don't talk about our health issues or death, because people feel that others will be discussing them. They become the topic of discussion around the dinner table or in the kitchen while cooking. So I think it is, even not being able to have children is an issue. Because people won't come out to discuss that they can't have children, because if they did come out, probably it won't be such a stigma. And
very true. Absolutely.
And people will be able to, it will just be a natural thing for there to be that process where you tell people, I can't have children, can you help me? But we don't have that. So you said something earlier on when you were speaking, you're talking on this subject. It mentioned Turner's syndrome, and somebody's picked up on that and says, what causes Turner's syndrome? Is it hereditary? And does it Is it hereditary? And there's another one. It says, "All children conceived." I don't know if that is part of that question or another one. But yes, so can you just touch on this topic, please?
Yeah, Turner's is one of the popular genetic disorders that that I always refer to. It is a genetic disorder. So it's again during fetal development, there was an underproduction of the gonad ovaries, so they just didn't grow in uterine.
Okay.
And we go back to abnormalities. So there's a healthy female,
Yeah,
but the organs carrying her fertility have not developed in uterine. So she's born without the ovaries, or very minute ones that don't function.
yeah.
So that's Turner's syndrome. It is quite common, but obviously within the fertility paternity, because I see this as a condition where women have to have donor eggs because they have got no ovaries or inactive ovaries. And Turner's women are they have short necks, so there's other anomalies with the muscle formation and things like that.
Yeah.
So it is a common disorder, and one of the highest reasons why women genetically need to have assistance from donor eggs.
Okay.
Yeah.
Okay. I think we've answered. There's still a lot of questions. I'm not sure. There is a question here that says, how many times can a woman donate her eggs in her lifetime?
Well, it's age between 18 and 35 is her fertility lifetime for donation. How many times? Again, they can they can achieve a maximum limit of 10 families. So what does that mean? That could mean that you donate 10 times, okay? But you may not have had a pregnancy or a family from the donations.
Yeah.
But I certainly wouldn't, as a health professional, advise anyone to donate up to that limit. We would accept, there is no sound level, but we would guide them to consider not donating after the 5th or 6th time.
Okay.
Because they've got to think about the health of their ovaries themselves. However, it's not to say, if you think about an infertile couple going through treatment, they may have 10, 15 cycles. So it's the same as a donor.
Yeah.
You understand? So it doesn't expose them to any greater risk of their future fertility. Okay. But it's more, how many times can you do this? And it'd be a great thing to do. But the limit is 10 families. So if a donor comes through, is successful each time, she can only do it 10 times.
Okay. Thank you very much. There's so many questions, which, I would copy them and send them to you by email so that I can put that out to people on our social media platforms. Good. If they want to, and if they want to ask any further questions, I will, direct them to you so you can help them and, give them advice as they need it. So I just want to say thank you again for coming on and speaking to us today. I know it has been a really interesting session. So I just want to say to everybody who's come today, I say thank you. We are at the end of the session, and as I said before, it's been an interesting, more than 1 hour actually. I want to thank Pauline for taking the time to speak to us about egg donation and how it affects the Black community, because obviously everybody knows we are hesitant about a lot of things. I hope that it has been an informative session and everybody's taking something away today. I cannot end the session without thanking all of you, our audience, who've come online to listen and ask questions, a lot of questions, I might say, or I might add. You have been really amazing in wanting to know more. However, Pauline has touched on another area that concerns us as a community. We do not donate. We do not think about donating to others. This hesitancy is prevalent across board, including in organ and blood donation. There are people on dialysis hoping for a second chance at life through people like you in this session today, as well as, you know, people who are watching the replay. You can be that hero. As a community, we do not consider organ donation, but now is the time to start thinking about it. I will encourage each and every one of you on here today to sign up to the organ donation register. If you're watching this replay as well, you are not excluded. Consider signing up to the organ donation register. If you cannot do this, there are other ways you can help. You can volunteer to help raise awareness about organ donation. You can also donate blood. We have a lot of events across Greater Manchester right now, and we hope that, you know, as time goes on, that hesitancy that we all feel, that stigma about donation, will manage to raise enough awareness to get people talking and remove that hesitancy, and it becomes a natural process for all of us to do something for somebody. I am a recipient. A mom who agreed to organ donation actually gave me a second chance at life. So you can do the same. You can help somebody. It could be your brother, sister, wife, uncle, people who are really close to your sisters. I'm close to my sisters. Any of them now need an organ. I will be out there. I will be campaigning because they did the same thing for me. So, and that's why I do this today. And that is why Pauline does what she does, because she's seen it over the years. People, you know, families who want to have children, but there are no gametes or eggs for them to be able to meet to actually realize their dream. So please, as you're on here today, when you leave this place, I know you'd have gotten enough information today. And the questions in the chat, as I said earlier on, I will send them on to Pauline. And once she replies to those questions, I will put them out on all our social media platforms so you can go read them. And if you need to get in touch with Pauline, please contact us via our social media platform or via our email. I think most people know our email, so there's no need to repeat that. To sign up to the organ donation register, you go to www.organdonation.nhs.uk/register your decision. Until next month, November, when we have a consultant renal physician who will talk about kidney disease and transplant again. It's going to, I don't know the exact topic yet, but I know it's going to be on kidney disease, obviously, and transplantation. I hope you join me again next month, and I will see you soon. Thank you very much, Pauline. Do you have any last words for the people who are here today, or people who are going to be watching this the replay of this session?
Again, I want to thank you for giving me the opportunity to expose this issue that we have in general, organ donation, gamete donation. And I really, really do hope that you will be able to think about the help that you can provide for these potential families to reach their goal and the desire to have their children and to welcome and extend their existing families. Being childless at the moment affects the couples, the individuals, the women, the men, the external families, the potential grandparents, the aunts and uncles. So it's a wider community that can be affected. In both areas here, donation is a gift. Donation is needed, and we really, really look forward to you coming forward to help in all aspects that you can do. Exactly. Thank you very much for listening.
Yeah, thank you very much, everybody. And again, I say, please sign up to the organ donation register. And when you've done that, please have a talk with your family and let them know your wish and leave them certain. Thank you very much, and see you again next month. Bye.